friends, today we are going to study the topic emphysema. It is nothing but it's an abnormal permanent enlargement of airspace from distal terminal bronchiole to alveoli. This is about the definition of emphysema. So let's see what is the functional area or functional section of the lungs. The functional section includes terminal bronchiole, respiratory bronchiole, alveolar duct and alveoli. Distal to terminal bronchiole to alveoli, this together called as acinus. Acinus is the functional unit of lung, and acinus contain two factors. They are damaging and protecting factor. This damaging factor results in the release of elastase. It is normally produced from neutrophil or macrophage. This elastase helps for the damage of harmful bacteria. If it is exposed to the lungs, it can damage the elastic fibers. To protect that damage, there is a protecting factor, that is alpha-1 antitrypsin. This alpha-1 antitrypsin is normally produced by liver. It is normally present in serum, tissue fluids and macrophages. So next we can see what are the causes of emphysema. Causes. The most common cause is smoking. Secondly, it's due to the alpha-1 antitrypsin deficiency. This deficiency is caused due to the defect in the normal gene, PIM gene. This is normal gene. This is present in chromosome number 14. The defects can be of heterozygous or monozygous. Like PIMZ is a monozygous gene, EIZZ is a monozygous, and this is heterozygous gene. If this gene is present in the the person can get this deficiency, alpha-1 antitrypsin deficiency, and causes the elastase to damage the alveolar and results emphysema. So next we can study what are the pathophysiology of emphysema. And firstly, while we are smoking, there is a release of toxic, also the free radicals. These free radicals can activates the alveolar macrophage. This free radical and toxin, these toxins can activate alveolar macrophage. This alveolar macrophage, as a result of stimulation, releases the cytokines or the chemokines called interleukin 1, interleukin 8, leukotriene B4 and tumor necrotic factor. These chemokines stimulates the capillaries, and as a result of the stimulation, there is an increase of neutrophils. Neutrophils to the site, and this neutrophils releases elastase, and this elastase can causes damage to the alveolar tissue. Tissue damage. Other than this, the free radical can also inactivates the enzyme called alpha-1 antitrypsin. As a result, there is an increase of elastase, decrease the or inactivate the antiprotease. As a result of inactivation, there is an increased elastase elastase, causes tissue damage. And other than the cytokines, this macrophage also releases a protease called metalloprotease. This metalloprotease destructs alveolar wall, causes the damage, tissue damage, This is an overall idea of what are the pathophysiology of emphysema. Simply we can say that it's an imbalance between the protease and antiprotease, or oxidant or antioxidant imbalance. This is about pathophysiology. So let's see what are the clinical features of emphysema. Firstly, dyspnea and weight loss and pursed lip breathe. Pursed lip breathing means it's like wrinkling the lips and breathe. That is pursed lip breathe. And also barrel chest. Barrel chest is due to when the destruction of alveolar causes the air trapped inside the lungs or alveolus, and that causes barrel or looks like a barrel. That's why it's called as barrel chest. And also flat diaphragm. This is the clinical features. Okay, so let's see what are the different types of emphysema. There are 4 types: distal ACINAR, pan ACINAR, Centri, lobular or irregular. First of all, we will see the Centri lobular emphysema. As you can see, there is a small lobule-like or a compartment-like structure. This is called as secondary pulmonary lobule. Each pulmonary lobule contains about 30 acinas. As we studied before, acinas is a functional unit of lung. So the Centri lobular emphysema affects the central portion of acinas, means respiratory bronchiole is affected. And the common cause is smoking. And it affects mainly the upper lobe. Among these 4 types of emphysema, we come across the clinically most important or most common type of emphysema, that is Centri lobular emphysema. Most common clinical emphysema is Centri lobular emphysema. So let's move on to pan-lobular emphysema. As you can see in this diagram, the entire secondary pulmonary lobule is affected, means the entire acinus is affected. Entire secondary pulmonary lobule is affected, and it is due to alpha-1 antitrypsin deficiency. Also, it's affect the lower lobe. Also associated with hepatic cirrhosis. So let's move on to the next type, that is paraseptal emphysema. As the name tells, paraseptal, it is distally to the secondary pulmonary lobule or peripheral to secondary pulmonary lobule. It's mainly the most common cause is smoking, and it is adjacent to pleural surface. Pleural surface. is associated with or can leads to spontaneous pneumothorax. What do you mean by spontaneous pneumothorax? Because as we know, the paraseptal emphysema affects the distal portion of acinus. The distal portion of acinus includes the alveoli. As the alveoli is ballooned or inflamed, alveoli may rupture. As a result, the air is spilled into the pleural cavity. That air in the pleural cavity is called spontaneous or the pneumothorax. So let's move on to the next one, that is irregular. Irregular, it is patchy involvement, and this is the most common microscopic emphysema. This is about the types of emphysema. So let's see some of the radiology images in emphysema. First of all, we will see the Centri ACINAR emphysema. This is a CT of axial view. As you can see, there is a small loosened areas, like dark loosened areas. Do you know what is loosened? Loosened means it is air-filled cavities. This is how the Centri ACINAR emphysema looks like. So let's move on to the next pan-ACINAR emphysema. As you can see, there is a bilaterally affected lung, the bilaterally affected lower lobe. The entire acinus or the entire lower lobe is affected. This is how the pan-ACINAR emphysema looks like. So let's see how the distal ACINAR emphysema looks like. As you can see, the small loosened areas adjacent to the pleural surface. This is how the distal ACINAR emphysema looks like. So this is about emphysema. So let's recap what else thing we studied today. We had studied what is the definition of emphysema. And what is the functional unit, acinus, and different types of factor, elastase and alpha antitrypsin, and what are the causes of emphysema, and what is the pathophysiology and how it's affected the alveoli. So this is about emphysema. So that's all for today. Thank you, friends.